I am Thatnursingprof and welcome to my channel. In today's video, we're going to be discussing all of the danger signs of pregnancy. We're going to talk about what they are, what they could possibly indicate, and can we do anything about them? So let's get started. You'll see here I've written all of the signs in this greenish color, and then I've underlined them with possible explanations. So here's our key for that. So the things that are key are etiology, our causes, could be blood pressure issues like chronic hypertension, gestational hypertension, preeclampsia or eclampsia. Clots, so a PE, so a pulmonary embolism, a blood clot that's traveled to the lungs, or an AFE, an amniotic fluid embolism. Infection, fetal distress, and there's something going on with the placenta. So let's jump into the chart. So first up, we have headaches. And I know you're thinking, well, everybody gets headaches. That's not a big deal. What is a dangerous headache? A severe headache that has photophobia, so sensitivity to light. It doesn't go away and it's very painful. That's a reason for a pregnant woman to go to the doctor or go to the hospital. Why? Because it could indicate there's something wrong with her blood pressure. Visual disturbances. So all of a sudden they start seeing spots or have blurry vision. Something's wrong with the way they see things. That's affecting the small capillaries in our eyes, the blood vessels in our brain. That's blood pressure again. Dizziness. So they're feeling lightheaded, like they're going to faint or pass out. Again, blood pressure. Having a systolic blood pressure increase of 30 or more. And this is 30 or more over your regular. So if you're normally low and then it goes up 30 and now it's a normal number, that's still not normal for you. Or if you're normally really high and it goes up even higher, that's dangerous. Same for your diastolic. So having a change in your diastolic by an increase of 15 or more, that's still important to know. So if they're watching you for preeclampsia or gestational hypertension and you are taking your blood pressure at home, they taught you how to do that, and you notice these changes, that's a big red flag. You want to call the doctor about that. Epigastric pain. So epigastric pain is not the same as heartburn. Heartburn or pyrosis is actually very normal. It occurs during pregnancy because of the hormones, causes the relaxation, and a little bit of reflux occurs. That's normal. Epigastric pain is not normal. Epigastric pain is like that mid-chest pain, okay? It's different than heartburn pain, and it's dangerous. Usually occurs with preeclampsia. Severe abdominal or flank pain. So you might have round ligament pain, which is the stretching and the growing of everything, and that might be a little bit uncomfortable. That's normal pain. But having a severe amount of abdominal pain is not normal. And then flank pain, so pain in your sides, okay? Flank pain, that could indicate a kidney infection. So that is why severe abdominal or flank pain, it's both a blood pressure thing and an infection thing. Burning during urination, so a UTI, that's an infection. And I know that kind of sounds like, well, that's pretty common. Who cares? Why is that a danger sign? Well, because that infection can turn into pyelonephritis, it can turn to a kidney infection, and actually it can actually cause contractions and put you into preterm labor. So we definitely don't want to get UTIs when we are pregnant. We want to avoid those. Drink lots and lots of fluids, right? So burning during urination, very important, does still count as a danger sign. Abnormal fatigue or nervousness. So these are kind of weird symptoms. These are obvious things like, oh, your blood pressure's changed, right? So abnormal fatigue or nervousness could indicate a pulmonary embolism or an amniotic fluid embolism. So scary things. The number one reason for maternal mortality in the United States is from a PE, so a blood clot traveling to your lungs. So it's very important that we take these symptoms, even though they seem a little generalized, very seriously. Okay, so abnormally fatigued, so having a hard time breathing, you're so tired, just the work of breathing is a lot for you, you're very tired. And then nervousness, that feeling of apprehension, that feeling of doom, something bad's going to happen to me. That's the kind of thing that happens with these. And amniotic fluid embolism, by the way, is incredibly rare, and that's a good thing. It has a really high mortality rate. Most people don't survive it, and if they do survive it, they have a very low quality of life, or it affects their life in a very negative way. So that's not a blood clot, because at least with a blood clot, we can dissolve that. With the amniotic fluid embolism, it's actually some amniotic fluid that somehow gets lodged into your lungs or your heart, okay? And it acts like a blood clot, but it's not blood. So amniotic fluid embolisms are really, really scary, but also incredibly rare. But they will have the same kinds of symptoms as a pulmonary embolism. Chest pain or shortness of breath, same thing. Our PE and our AFE. Muscle irritability, so we're starting to get twitchy, or maybe we're hypertonic, we're real tight, okay? Or maybe we have really increased reflexes, right? All of this is talking about central nervous system involvement, probably because of really high blood pressure. You probably have severe preeclampsia that's trying to work its way into becoming eclampsia. So we need to take that seriously. Confusion, again, blood pressure, and then seizures. Seizures is now we've made it to eclampsia. And remember, when you're having a seizure, you're cutting off oxygen to the baby, right? So it's very important that we do everything we can to prevent these seizures from happening. Vaginal bleeding is a placenta problem, and there's lots of placenta problems. It could be because of an abrupto placenta, so the placenta is trying to prematurely separate, It could be because of placenta previa, so the positioning of the placenta is wrong. So all bleeding is bad during pregnancy. So just remember, bleeding equals bad, okay? So if you're bleeding and you're pregnant, you need to get that checked out right away. Leaking of fluid. Now, I know you're probably thinking, well, that sounds like a good thing. Why is that dangerous? Your water's supposed to break, right? So, yeah, your water's supposed to break when it's time, when you're ready. But if you're not ready, if you're not term, if your baby's not healthy, if you're going into preterm labor, leaking of fluid is not a good thing. But also the biggest thing about this is infection. So the longer your water is broken, the more likely you are to have an infection. So let's talk about that. So when your water breaks, it causes your pH, your natural pH of your body, to become very basic, which is just asking for an infection, okay? So somebody whose water that's been broken for 16 hours is much more likely to get an infection than somebody who's had their water broken for 10 hours. The longer your water is broken, the more susceptible you are to infection. And if it's not that obvious movie gush like we see in films and TV where it's oh my God, right? Sometimes it's not like that. Sometimes it's like a tiny little trickle where patients will even think, did I just urinate on myself? What was that? Okay? That's leaking of fluid, and we need to know about that, because if that is the case and you are going into preterm labor, or if your bag of water is broke prematurely and you're not even in labor, you need to be started on antibiotics. And then decreased fetal movement. This is indicative of fetal distress. So not feeling the baby move. After you're used to feeling the baby move, maybe you're doing your kick counts and you go to do them and you can't feel that baby move, something's going on. Okay, baby's under distress. That's a danger sign. You need to tell doctor about that right away. And then finally, having a temperature over 100.4 degrees Fahrenheit. So infection. Choreo, possibly, but any kind of infection is bad. Okay, it's bad for you and it's bad for baby. So now that we've talked about the danger signs and what the possible causes are, what can we do about them? So our blood pressure ones, so all of our ones here in red, what our goal is to prevent them from becoming eclampsia. Really. If the blood pressure problem is a chronic hypertension or a gestational hypertension, we can maybe give antihypertensives like labetalol or hydralazine, trying to control that blood pressure as best we can. If it's a preeclampsia cause, we can give those antihypertensives, and then we can also give something called magnesium sulfate. And remember, our goal is to prevent preeclampsia from becoming eclampsia. And then if it is eclampsia, okay, we're going to put that patient on seizure precautions. They're 100% going to be on MAG, and we're probably going to deliver that baby. If the patient has a PE or an AFE, What we're going to do is we're going to give oxygen. We're going to have the head of the bed elevated, and they're probably going to need to go into surgery, maybe get some blood thinners. It kind of depends on how severe it is and how they're acting and how symptomatic they are. But either way, it's always an emergency. If it's an infection, we're going to treat the infection, or we're going to try to prevent the infection from happening. So the water's been broken for a really long time. Maybe you're not showing symptoms of infection yet. Maybe you don't have an increased temp or anything like that. Maybe baby's heart rate is stable and it's not showing distress. That's all good. So we want to prevent anything bad from happening. We're going to start you on prophylactic antibiotics. If baby's in distress, it kind of depends on what's going on. So decreased fetal movement could be a major emergency, like you need to be unconscious and have an emergency C-section. We need to get that baby out right away. Or you could be near the end of your pregnancy. You could be 39, 40 weeks. You're close to your due date, and all of a sudden you're like, I don't feel the baby move so much anymore. You could be having contractions and not feeling them. The babies don't move as much near the end, and they don't move as much when you're having contractions, so you might not feel them. But either way, that's still a reason to go to the hospital and get checked out. When it comes to placenta problems and what we can do about it, it really varies on the patient, what the problem is, how severe it is. So it could be something as simple as pelvic rest or bed rest, nothing in the vagina, no getting up, walking around. Or it could be you need an emergency C-section right now, right? So it really varies what we can do depending on what's going on with our patient. So these are the danger signs of pregnancy. These are the categories of the possible causes of these danger signs. And then hopefully we know a little bit more about what can we do to manage these danger signs. Every single one of these needs to be reported to a healthcare provider right away. And if your patient doesn't know that, it's your job to educate them. You need to teach them about these danger signs and tell them, you need to call me if any of these things happen and let me know. And it could be simple as, coming to the clinic and getting checked out in the clinic and it's no big deal, or it could be a major emergency, you need to have surgery right now. So it's going to vary, it's going to be different, but the important thing is that you teach them what these danger signs are so that they know to tell you when they happen. So I hope you found this video helpful. I know this was kind of like a scary topic, I'm sorry, but it does happen, so we do need to know. Important patient education. If you have any questions or comments, let me know, and if not, I'll see you on the next one.